Role of physiotherapists in ICU. What is our role? What the physiotherapists are doing in the ICU? Basically, we are evaluating and treating cardiopulmonary impairments and the functional limitations. What does mean by impairment? It's a consequence of disease, pathological processes, or lesions. So any alterations in the anatomical, physiological, or the psychological structure or function is known as impairment. So we are treating the impairments and the functional limitations. So what does mean by functional limitation? It's an inability to perform an action. Something is disturbing their daily routine, daily actions, either the physical or the mental, because of the physical or the emotional restrictions. So both will influence the daily living activities. That is what means the limitation in the functional activity. Cardiopulmonary impairments increase in amount and viscosity of separations. It affects the pulmonary functions. Difficulty in breathing, that also affects the pulmonary function, reduces the air entry, and moreover increases the respiratory rate, the quality of respiration which reduces. An altered breathing pattern, apical breathing using accessory muscles, reduces the quality of breathing, lung volume and capacity get reduces. And ventilation, perfusion, mismatches, abnormal posture that affects the respiratory functions. In general, weakness, atrophy of respiratory muscles increases the risk of respiratory failure. An increased risk of EVT inside the ICU because of long-term hospitalization, immobilization. There are a risk of DVT inside the ICU. Bed rest complications. So deep conditioning cases. Patient will get a bed sores, pressure sores due to long-term hospitalization. And patient will get the psychological impairment. Those are inside the ICU long-term. They get ICU psychosis. It's an emotional stress. And joint stiffness because of immobilization and altered sensation. So functional limitations. So coughing. If there is any excessive coughing, it restricts the movement, reduces the activity of patient, and limb movements will also be affected inside the ICU. And rolling, the bedside activities will also be affected. And self-care activity will be demanding. So we have to encourage and we have to treat all these functional limitations in assessment. We'll discuss in the next video. Thank you.